So today we're going to continue with the integumentary system, which is basically the skin. But we were talking about the layers of the skin. The skin has got two layers, epidermis and dermis. And we talked about the 5 layers of the epidermis. And then we were talking about the dermis. The dermis has got 2 layers. It's got a papillary layer and a reticular layer. The papillary layer is mainly areolar tissue, and the reticular layer, which is below it, and it's much bigger than the papillary layer, is made up of irregular fibrous connective tissue. You might recall that fibrous tissue are 2 types. There's a regular and there's a irregular. Regular is seen where? In the disc, intervertebral disc. They act as shock absorbers. And under the microscope, you can see the regular is like parallel bundles of collagen. Irregular is like they're going in different directions. They are more adaptable to unpredictable stress. So the reticular layer has got a lot of this collagen fibers, and they're running here and in different directions. And that's when the collagen fibers are stretched. For example, in pregnancy, when they are stretched and when they burst, that's when you get these little birthmarks or striae. Okay, so striae is actually rupturing of the collagen fibers in the reticular layer of the dermis. Okay, so we discussed all that. So today we are going to go through the layer which is below the dermis, and that is called the hypodermis. That's not part of the skin, okay? So when you were in the lab, you saw that there were a lot of tissues there, and some of you focused on the muscles, some of you focused on the fat, some of you. So in that slide, which was saying the skin, you probably saw the epidermis and dermis, but that's always on the surface because after the skin, it's air, right? So you really have to look at the surface layer under the microscope in order to see the epidermis in the lab. Okay, so what is the importance of hypodermis? Hypodermis is also called subcutaneous tissue or subcutaneous fat. It's very important for surgeons because when you're cutting tissues, how do you know where you are? You can take a scalpel and you can cut it, and you can go really down. So the subcutaneous tissue is an indication. Now you are here. So and it's a good layer to see because it's that yellowish, fat is yellowish, okay? So when you reach there, you know, okay, now in the subcutaneous tissue, that's my depth. And under the subcutaneous tissue, there's muscle. So if you're going to do a muscle surgery, when you reach the fat, you have to slow down because next your muscle is going to. So it is actually a good indicator for surgeons. So the subcutaneous tissue or the subcutaneous fat is what you see here, the yellowish. And since it is fat, it provides a cushion. So it also provides some thermal insulation, which means you don't lose a lot of body heat. And also it's an energy reserve because fat is a good source of energy. Another use is that it's a site of where you inject certain drugs, for example, insulin. So insulin shot is usually given into the subcutaneous tissue. Why? Because the subcutaneous tissue has got a lot of blood supply. So if you give some injection into that layer, it'll be absorbed fairly quickly.
What steroids?
Steroids, Yes, you can. Normally steroids are given into, because steroid there's more bulk, so you give it into muscle.
Yeah.
But you can give it into fat also. But the fat usually takes about there's a limit. I forgot the limit how much you can inject, but insulin is only small quantities. So it's so many units of insulin. So insulin is the perfect example for subcutaneous injections. Okay, we talked a little bit about skin color. What did we say? The number of melanocytes, or the cells which produce melanin, is kind of constant. Okay, so what's the types of pigment produced by the melanocytes? Two types. There are eumelanin, which is a brownish black pigment, and there's the pheomelanin, which is a reddish yellow pigment. These are the two pigments. And the pheomelanin contains a lot of sulfur. That's why it has got a different color. So skin color is really a combination of eumelanin and pheomelanin. That's why you see a spectrum of colors. You see very light, dark, different colors, blonde, all these colors, because you have a combination of pheomelanin and eumelanin. Now, even this hair color is also because of a combination of this. We'll come to the hair in a few minutes. So we spoke about the melanocytes. We said the melanocytes in a dark skinned person and a light skinned person is almost the same. Okay, there's no change in the number, but what is different is the activity. The melanocytes are more active, which means they produce more melanin, and also the melanin that they produce does not break down quickly. Another thing is that the melanin that the melanocytes produce are more widely distributed. In lighter skinned person, lesser quantities of melanin. Whatever melanin is produced breaks down quickly and not widely distributed. That brings us to skin tanning. People go get a tan, they think it's very healthy. No. Tan is not a sign of health. Tan is actually, it shows that the skin has been irritated. Okay, so melanin is a protective mechanism. When you go under the tanning machine, or if you go into the sun, what's going to happen is that the melanocyte starts producing melanin. It's a defense. The skin is trying to defend itself from the UV ray. So tan is actually a sign of skin defense, not a sign of skin health. Yeah.
About asphalt curve.
It's there. Yeah, we're coming into that. Yeah. So what happens when you're hit by UV light? The melanocytes are stimulated and they produce more melanin. And that's what makes the skin darker. Some of the pigments which can influence skin color, one is keratin. Keratin is a yellowish or orange pigment found in vegetables like carrots, sweet potatoes, and it probably gives a little yellowish tint to the skin. Not much, but there's a slight yellowish tint. But the color of the skin has got some diagnostic value. For example, cyanosis. Cyanosis means bluish discoloration. When it usually, you can see that in children very often. You can see that in the elderly, people who have lung diseases, because they don't get enough oxygen, and there's an oxygen deficiency due to lung problems. So the hands or the lips or the, the mucosa, any place where there's mucous membrane, it becomes blue, and this is called cyanosis. Erythema is redness. So if you get a hit, suddenly you can see that there is a little redness in that area. Erythema is a sign of inflammation. Inflammation is when the skin is irritated by trauma, infection. Any irritation will immediately increase the blood supply to that area, and that's called erythema. It's redness. So that's what you see here. Pallor. People sometimes, when they are very pale, you look at them and say, you look very pale. Probably they are very tired. Probably they have anemia. So when you have low hemoglobin, you have a pale appearance. So anemia is when you have a low, what? Red blood cells or hemoglobin. When you have a low hemoglobin, you call that anemia. Albinism. This is albinism. What is that? No melanin at all. It's a genetic condition. When they're no melanin, they have melanocytes, doesn't produce any melanin. Lack of melanin. Jaundice is a yellowish discoloration of the skin. Why is that? It's because there's a buildup of a pigment called bilirubin. And where do you see that? In liver damage, usually in jaundice, right? When you have hepatitis. So that is when you have a compromised liver function. And hematoma is collection of blood under the skin. So if you get hit by something, sometimes you can get a pool of blood under the skin, and that appears like a hematoma. That's a hematoma. So all of these different skin colors gives you an indication of what's happening beneath. Okay, moving on, we're going to talk a little bit about skin markings. The most important one is fingerprints. So when you go for your any kind of background check, they want you to do a fingerprinting because your fingerprints are unique, right? And what is a fingerprint? Fingerprint is in the epidermis. We have these projections which are going down, and in the dermis, we have these projections which are going up. The ones that are going down are called the epidermal ridges. The ones that are going up is called the dermal papilla. So one is going down, one is going up, so there's an interlocking happening. And it is actually the ones that going down, the epidermal ridges, which is responsible for your fingerprints. So that's about fingerprints. And the next thing is flexion lines. So when you bend your skin, you find that there are some creases produced. And these are called the flexion lines. Usually that's the area where the skin folds. And it's of some value to surgeons because if you don't want to put a scar, say you want to do a surgery here. What's the common surgery you do here? Carpal tunnel, yeah, carpal tunnel. So I don't think we are touching carpal. I'm not sure. Maybe we are. So if you want to do a carpal tunnel, you're just releasing this the space here. You don't want to put a scar here anywhere where you can put it in the crease because there's already a crease there, so you can utilize that crease in order to avoid another scar. So surgeons use that to mask scar. The next is freckles. What is a freckle? It's a melanized patch. It's a flat melanized patch. And then you have a mole, which is a raised melanized patch. And often there's hair on a mole. Moles, are they dangerous? they can become a condition called melanoma, which is dangerous. So if you have a mole, you have to do a self-examination, and that's called the ABCDE rule. So A stands for asymmetry. So if a mole is kind of symmetrical, yeah, that's okay. B, if it is, look at the border. Is the border starting to expand? Okay, if it's a smooth border, or is it kind of creeping out like fingers? So that's B, border, irregularity. Color, is there any color change? Another thing is diameter. Diameter, anything more than 6 millimeter is a little, dangerous, okay? Up to 6 millimeters, you don't have to worry too much, but after it goes over 6 millimeters, you have to be a little careful. And the last one, E, is evolving. That means it's starting to change the appearance. So we follow the ABCDE rule, which you can do it yourself. So all you have to do is take a picture, take the camera out, take a picture, check it after 6 months. And if you think there is a change, go to your doctor. Okay. So that's the best advice I can give you if you have a mole. Hemangioma or birthmark, you see it in children. That is, hemangioma is actually a benign tumor of the blood vessels. So the blood vessels proliferate. Tumor is when tissues just start proliferating. So here, the blood vessels proliferate, but it is benign. So there's a benign tumor and there's a malignant tumor. Malignant tumor is cancer. Benign tumor means it is not cancer. It's benign, innocent. Okay. So far we were talking about the epidermis and dermis and all. What are the accessory organs? So we have nails, we have hair, there are cutaneous glands, and the hair and the nail are just like the stratum corneum. We said the outer layer is dead cells, right? It's dead cells and it is filled with keratin. Why? What does keratin do? Waterproofing, exactly. So it is preventing loss of water. Can you believe that the hair and nails are also exactly, it is keratinized structures. But the difference is that the keratin in the stratum corneum is soft keratin, whereas in the nails or in the hair, it is a different type of keratin. It's hard keratin. So that's the difference. Why is it hard? Because the keratin has got a lot of cross linkages. So the cross links between the keratin molecule is because they have more sulfur atoms. That increases the number of cross links. Hair. So hair, even though we think that it's not very important, cosmetically it's very important. People get very worried about hair. So let's have a look at that. Are there hairless zones in the body? Yes, especially the palms, sole of the foot, the lips, this area here, no hair. The nipples, part of the genitalia, there are hairless zones in the body. 3 types of hair. The first hair, which appears on a fetus, is called the lanugo, superfine and unpigmented. The next type of hair, which replaces the lanugo hair at the time of birth, is called the vellus hair. It's fine hair that you see in a baby. And then later you have the terminal hair. So the terminal hair is a longer, coarser, and heavily pigmented type of hair. So that's where you see in your scalp, in your hair, in your eyebrows, eyelashes, all those. But after puberty, the hormone always converts the vellus hair into the terminal hair, especially in certain areas, like the axilla, in the genital areas. You can see hair starts developing in those areas. And also in men, you have the beard, the facial hair. So terminal hair is something which happens later in life, and it is thicker and it is much darker compared to the vellus hair and the lanugo. Structure of hair. So if you look at the hair, the part that is outside the skin is called the shaft. The portion inside the skin is called the root. And this little tube-like structure which surrounds the root of the hair is called the follicle. So the hair root is embedded in the hair follicle. And at the base, you have this bulbous area, and it is called the bulb. And that's a little swelling, and you can see the blood vessels entering at the base through the bottom. And this is the growth center for the hair. Hair receptors. So if there's an ant crawling on your skin, you'll immediately know it. Even if a mosquito comes and sits on your face, you will know it immediately. Before the mosquito bites you, you'll know it is something on your face. Why? It's because your hair, the hair follicles are surrounded by nerves. So when the hair moves, the hair follicles are stimulated. When the hair follicles, the nerves are stimulated by the hair follicles, and the nerves, when they are stimulated, they fire, and the impulses reach the brain. The sensory area of the brain tells you there is something on your skin. It's very fast. So that is the role of these hair receptors. Again, attached to the hair follicle, there's a muscle. It's a smooth muscle, and this muscle is called a erector pili muscle or piloerector muscle. And when it contracts, you get these goosebumps because all your hair starts standing up. When does that happen? Cold, yeah. When you're frightened, when you get a fright, that's when you get stimulation. It's a smooth muscle, so it's involuntary. It's not under your control. So it is causing goosebumps. Again, texture of hair. Why do some people have curly hair? Why do some people have straight hair? Simply because of the cross-section, the shape. If the hair is round, the cross-section is round, you have straight hair. If you have flat cross-section, then you have curly hair. Hair color, I told you, is due to melanin pigment. Two types of melanin pigment. You have eumelanin and pheomelanin. And brown and black hair has got a lot of eumelanin. Blonde hair, red hair has got a lot of pheomelanin. And what about graying of hair? Gray hair appears when melanin stops production. When the melanocytes stop producing melanin, you get gray hair or white hair. White hair is really when it completely stops. Gray hair is when the production of melanin slows down. Hair growth, it's not a continuous process. It's always in 3 stages. There's an anagen stage, which is usually the active growth phase, lasts for about 2 to 6 years, and the hair grows in length. Then what happens is you have the next phase called the catagen. Catagen lasts for about a couple of weeks, the growth stops, and the hair bulb breaks away from the papilla, and then you go into the next stage called the telogen, which is a resting stage, and the hair is now called the club hair. So what happens, and the club hair is just like a hair which is not growing. It sits there for a little while and then it falls off. That's why you will lose hair. And people get worried when they lose hair. That is normal. You have to lose hair because after growth it stops and then it falls. That's because a new hair is going to come. So everybody loses about 100 to 150 hair, or is it 50 to 100, which is normal. And scalp hair grows about 1 to 3 millimeters every day. What do you call hair loss? Alopecia. Alopecia is something which worries people, but sometimes if it can be worrying particularly if you start developing baldness very early. And many things which makes it worse is disease, poor nutrition, emotional stress. All these things can make it worse. And this is very common in males. You can see males have this particular pattern of baldness. It is called androgenic alopecia. It is only seen in males, and it's influenced by the male hormones like testosterone. Hirsutism is growth of hair in women, excess growth of hair, which normally, is not there. And sometimes when you have a hair on your face growing, that's when we call it hirsutism. And it's usually linked to some hormonal imbalance. So that's when you go to the dermatologist, and sometimes the dermatologist will look at your hormonal profile to see maybe you're having a little tumor which is producing excess amount of hormones, which is stimulating the hair growth. So functions of hair: it protects you from the UV rays. It is the hair receptors. They are very sensitive and provides you a sense of sensation. The eyelashes protect you from debris. Eyebrows are very important for nonverbal communication. You're surprised, you're angry, everything shows, all right, on your face. The hair in the nose filters the air that's entering. Body hair does not have much function. It does not. It's not earlier, probably in early animals, probably it provided some insulation, but for us, we don't have that number of hair in humans. Nails. Again, nails and hair are packed with hard keratin. Skin is packed with soft keratin. That's the difference. Why do you need nails? It's like a little plate. If you want to pick something from the table, if it's small, you need nails, right? So that little plate, which is helping you for picking up small things, scratching, all those things. The nail has got 3 parts. There's a body. So this is the body. There's a cuticle. That's a part which is attached to the skin. There's a lineule, which is like a half moon. You see this white area? You look at the nail, and you can see there's a half moon structure, which is lighter in color. But particularly if you look at the thumb, you can see that. And the free edge is the part that we cut. Sweat. Sweat is produced by sweat glands. And we talked a lot about the different sweat glands in the lab. So you have the merocrine sweat glands, which are the most numerous type of sweat glands seen all over your body. So sweat glands are really like coiled tubes. So the merocrine or apocrine sweat glands, this is a merocrine sweat gland, and it's also called an eccrine gland. It's a coiled tube, and the difference is that it opens on the surface. of the skin. The other type, which is the apocrine, only seen in certain areas, like it is seen in your axilla, in your armpit, in the genital areas, and also in the anal region. The difference is that apocrine sweat glands are inactive until puberty. After puberty, it becomes active. And there's another difference. The apocrine sweat glands, they don't open into the skin. Let me move this. Yeah, they don't open into the skin. They open into the hair follicle. And the secretions are much thicker than the merocrine. The secretions are usually, there's no order, but after a while, the bacteria will settle. It's thicker, it contains a lot of proteins and all, so it can break down and it can cause a characteristic smell, which we call body odor. And scientifically, that is called bromhidrosis or bromhidrosis. Both merocrine and apocrine sweat glands, they have a type of cell called myoepithelial cell. Myo means muscle. So these cells, they wrap around these sweat glands and they squeeze the sweat glands so the sweat is pushed out. Myoepithelial cells. Functions of skin, I just put this to make you understand. We talked about that skin is a barrier for losing water. Anything else? Skin, what else does it do? Vitamin D, right? Vitamin D production. It provides sensation, thermoregulation. Another important thing, many muscles in the face are attached to the skin. That's why you have facial expressions. So it's very important for nonverbal communication. Sebaceous glands. What are they? What do they produce? Oil. They are the oil glands. They open into hair follicles. So this is a sebaceous gland. And the sebaceous gland produces oil. Oil is called sebum. That's why it's called sebaceous gland. And we talked about the different types of glands. We said that there is a type called the holocrine gland. Holocrine gland actually fills up with the sweat gland. I'm sorry, the sebaceous gland is a classic example. It fills up and the whole cell bursts. And that's how the sebum or the oil comes out. And that's what keeps the skin and the hair from becoming dry. And so this is used, especially this is very important to keep your skin moist. So we have something called lanolin, which is obtained from sheep wool. That's what these people may use a lot for making these moisturizers and lotions. They use lanolin. It's very similar to the sebum. Another type of gland, particularly seen in the ear, is called the ceruminous glands. What does it produce? It produces wax. Wax sound as if it's yucky, but it is not. It's very protective. How is wax produced? Wax is produced because there is sebum or the oil, which combines with the dead skin cells. We said the outer layer of the skin is always exfoliating, right? So they combine together. That's what wax is. It waterproofs the canal, the ear canal, inhibits bacterial growth, keeps the eardrum pliable. Mammary glands. Mammary glands are modified apocrine glands. They produce milk, fully developed during pregnancy. and produce milk. In animals, you see that there are 2 rows of tissue, which is called the mammary ridges. In dogs and all, you can see they have a lot of nipples. So that's because they have 2 rows, but in humans, we only have 2 mammary glands. But sometimes you can have additional nipples, and that condition is called polythelia. Skin. Can it have cancer? Yes, it can have cancer. Why? Mainly because of sunlight. And skin cancer is usually seen in the exposed areas of the skin, usually seen in people, in fair-skinned people. And there are 3 cancers which I want you to be aware of: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Let's quickly go through these 3. So basal cell carcinoma, BCC, is the most common. And it starts from the basal layer of the epidermis. But it's the least dangerous of the 3. So this is how it starts, like a little small shiny bump. And you can see that little beaded appearance. Squamous cell carcinoma, or SCC, squamous cell carcinoma, they arise from the keratinocytes, usually seen in the sun-exposed areas. This has got a higher chance of metastasis. Metastasis is the problem in cancer. What is metastasis? The cells in the cancer is multiplying, and sometimes they break off. They go to another part of the body, and then it starts developing a tumor there. So it branches out. It goes through this, it can go through the blood, it can go through the lymphatics, it can go to another part of the body and start growing there. That is metastasis.
I have a question about metastasis. When a skin cell has cancer and it metastasizes somewhere else, is it still skin cells?
Well, it doesn't, it could be a cancerous cell. So it could be a squamous cell carcinoma. So we are talking about squamous cell carcinoma now. So it'll become a squamous cell carcinoma. So the chances of squamous cell carcinoma metastasizing is more than the chance of a BCC or a basal cell carcinoma does not metastasize. Whereas but it doesn't become skin cancer, it becomes squamous cell carcinoma. It's a carcinoma of the squamous. So you're going to see cancer cells there, not skin there.
Well, I'm saying if the cancer moves to the lungs, does it mean I have skin cancer in my lungs versus lung cancer?
It is lung cancer. It becomes squamous cell carcinoma. It's a type of cell which is important. It's not where it is located. Nature. Yeah.
All right.
But even SCC is it's not very common. Metastasis is higher than BCC, but still it is not bad. If you can catch it early, you can treat it very well. This is the dangerous one, the 3rd one, malignant melanoma. Malignant melanoma spreads like wildfire. And it is less common, that's good, but much more dangerous. Why? Because the chance of metastasis is higher. Greatest risk is family history. So if you have somebody who's got a high family history of malignant melanoma, you have to be very careful. Also, if somebody is sunburned as a child, and also somebody who has got a lot of moles in the body, fair-skinned people are much more at risk. And so you have to be very careful. When I say you have to be careful, you have to protect yourself from sunburn. You have to, if you have a mole or something in your body, you have to do a self-examination. A, B, C, D, E. We discussed that. Okay, so you have to keep an eye on things. Okay, you cannot say my dermatologist will look after it. No, you look after it, and you go to the dermatologist, and you tell the dermatologist, I took a picture, and this is what it is. Okay. So you are the doctor. You have to take the lead. You're responsible for your health, not the doctor. UV radiation, there's UVA and UVB, but both are equally bad. And some protect SPF. People think that if you put some SPF on your body, you're protected. But SPF only protects from UVB radiation. And it gives a false sense of security because people think, oh, I put my sun protection. No, that is only part of the protection. And and many people, they rub this big amount of lotion on their face, and that's it. That's not how you do it. You have to keep reapplying it.
What's in it? It's metal, right? It's nasty.
SPF, yeah, sun protecting the factor.
It's some
Yeah,
kind of
actually, I
metal.
don't know. It's some. I think it's some. What is that metal? About
Something.
some. What is that? It's a white metal. What is it called? Zinc? Is it zinc?
Zinc.
Zinc. Yeah, yeah.
It's nasty.
So it is zinc. Yeah.
With dress.
But you have to seek other. You have to seek shade. You have to wear protective clothing. You have to wear hats. All these things. Yeah.
Are SPF creams and lotions required to tell you if it's UVB and UVA protection?
It only protects against UVB. It doesn't protect against UVA. That's why the manufacturer just promotes it and gives you a false sense of security. So that's why we are having these courses here and we are talking about these things. So that's not the fully protective. You have to take other measures. Another important thing is burns. Burns happen from fires, exposure to acids, electrical burns, exposure to radiation. All these things can cause burns. And the immediate problem after burn is you lose your epidermis. So your water barrier is gone. Your water protect, what do you call the water barrier, yeah, the water barrier is gone and you start losing. So fluid loss is the main problem in burns. The second important problem is infection. Infection, and sometimes your skin is charred or burned and dead. So it produces toxins. So it can release these toxins. So sometimes when you have a burn, you may need what is known as removal of that scarred area, which is called, and this process is called debridement. Now, how do you classify burns? There's a 1st degree, 2nd degree, 3rd degree burns. So 1st degree means it only involves the epidermis. And when you get a burn, what you see is redness. That's all. You see slight redness and you feel slight pain. And it heals without any problem. 2nd degree means it involves the whole epidermis, and part of the next layer, which is the dermis. And this is the one which is characterized by blisters. So if you get a blister, it is a 2nd degree burn. Healing takes longer. 3rd degree is what we call a full thickness burn. It involves all of the epidermis and the dermis. So the skin becomes brown, leathery, charred. And surprisingly, it is not painful.
Even when it happens,
Well, the nerves are completely gone.
there's no pain.
There's no
Right,
pain.
yeah.
There's no pain in a 3rd degree burn. Whereas the 1st degree and 2nd degree are painful. So people are worried about the 1st degree and 2nd degree. The other one is, I'm pain, I have no pain. No pain, no problem. But the damage is more. It's because the nerves are all gone. And scarring is inevitable. That's where you get a huge amount of scarring. I remember seeing a patient who was, he was in a car accident and he called the police and he was sitting in the car, he couldn't get out of the car. He was waiting for the ambulance. While he was waiting, he took a cigarette, lighted, the whole thing went good. And so he had a lot of skin grafting. That poor man, he went through hell. But he was a very jolly fellow. He survived, yeah. So sometimes when you have these horrendous burns, you need skin graft. So skin graft means skin is taken from another location in your body, and that's called autograft. So you take skin from a non-burned area, put it into the burn, it gives a protective cover, and it stimulates the growth of tissue there. If you have an autograft, which is from the same person, there's no rejection. That's the best option. Then you have an isograft, which is from an identical twin. Again, that is the second best option. If that's not available, you can have a homograft, which is from another person, another human, usually somebody who is deceased. It will be rejected, but it provides a temporary cover. So it gives a stimulation for the cells to regenerate. And then you can have heterograft, which you take skin from other species, usually pigs and all. So again, that will be rejected, but it provides a temporary cover. Any questions? That was a lot. So, but we're not stopping here. We're going into bones. So what do I do?
Would you